Hello everyone, good afternoon. Welcome to Aakash BYJU'S NEET channel. I'm your teacher Ankita and I welcome you all in today's class where we will be discussing about the reproductive health. So I hope that all of you are ready for the class. Good afternoon everyone. Good afternoon Pampa, Bhagya, Devanshi, Radhika, Teerthraj. Good afternoon everyone. How are you all? Sab badhiya, sab sahi. I hope that I'm clearly audible and visible to all of you. Thank you Radhika, I'm good. Thank you for asking. I hope that you're also good. कैसा रहा आप लोगों का weekend everyone? I hope that you got a chance to go through the human reproduction. I hope आप सबने NCERT पढ़ी अच्छे से. All clear. Okay, thank you. Very good. Yes Ashwini. All clear. Okay. So everyone, today is a very special class, right? NEET पर विजय की तरफ हम और बढ़ते हुए. We're doing class 12 के chapters because उनके board examination pass में, of course, we will be covering up the other chapters also. It's not that we are just focusing over here. From the upcoming weeks, we surely will have more of the mixed bag of this. Yes. Purvi, thank you for coming here and telling this message, बच्चे. We'll try. Yes. हाँ. Okay. चलिए. Very good, Radhika. Very good. That's good. Yes, Purvi will try to have, right? We will, if not live, we will try to have, a mix of all the videos putting out there for tomorrow for you. Awesome. Chali everyone, let's get started. I want all of you to focus over here now. Everyone, please do make sure that you're hitting the like button for the video, right? Really hope that all of you are excited for our class today. And let's get started, right? Thank you, Purvi. Okay. No, it's okay. I understand perfectly and thank you for coming here and letting us know that what is the requirement. Thank you. Chaliye. Everyone, let's move ahead and let's talk about the reproductive health. Now this chapter is very essential. हमें पता है कि chapter बहुत important है. अब इस unit में जो सभी chapters हैं सभी important हैं. तो ऑफकोर्स इसमें से हमने देखा है पिछले साल में कि 3 से 4 क्वेश्चंस आते हैं, तो होपफुली इस साल भी हमें उतने क्वेश्चंस मिलेंगे. सो लेट्स टेक अ लुक ओवर हियर. इजी चैप्टर है, बहुत स्कोरिंग है, बहुत कुछ याद रखना है इसमें. रिप्रोडक्टिव हेल्थ की अगर हम बात करें, सो व्हाट इज द रिप्रोडक्टिव हेल्थ? जल्दी से बताइए. इट्स अकॉर्डिंग टू द WHO, WHO ने क्या बोला था कि इफ द पर्सन इज रिप्रोडक्टिवली बेसिकली इफ द पर्सन इज रिप्रोडक्टिवली हेल्दी मीन्स टोटल वेल बीइंग इन ऑल एस्पेक्ट्स ऑफ द रिप्रोडक्शन, दैट इज फिजिकल, इमोशनल एंड बिहेवियर एंड सोशल. हेल्थ की डेफिनेशन में हम 3 चीज याद रखते हैं, दैट the person should be physically fit, emotionally fit, and and socially fit, and they should not just merely have the absence of disease. So here we have the definition of reproductive health, right? एक सेंस में WHO हमें बता रहा है कि reproductive health means a total well-being, right? In terms of the reproduction, physical भी fit होना चाहिए individual, emotionally also, behavior also, and of course socially. इसके अलावा according to the 2011 census report, the population growth rate was less than 2%, right? At which our population would increase rapidly. So this is something which was very, very alarming for all of us, right? Now we have various common elements that we have for the reproductive health. Now there are the various few important elements that we have in the reproductive health, and what are these? Pregnancy and fertility, contraception, menstrual cycle, emotional well-being, social well-being, and the information, the knowledge about these sexually transmitted diseases. So we can say that all of these, right, all of these topics will be able to, the individual will be able to cater or to understand if you're putting this in the reproductive health ka window, right? So these are the important common elements. These are the things that are, categorized or are present in the category of the reproductive health. So if we're talking about the reproductive health, of course, we will be discussing about all of these topics. इसके अलावा अगर हम बात करें पॉपुलेशन ग्रोथ की, सो वी कैन सी कि भाई एक्सपोनेंशियली हम कुछ देख रहे हैं, बढ़ता जा रहा है. सी फ्रॉम 30 crores to 134 crores, right? We can see how the population have been growing, and we can clearly see and say that कि भाई the population growth is happening there's no barrier. Exponentially the growth is happening at a very fast pace. We can see that the population is growing. Now if I ask you कि क्या ये हमारे एनवायरनमेंट के लिए सही है, तो हम क्या बोलेंगे? बिल्कुल नहीं, बिल्कुल सही नहीं है, क्योंकि पॉपुलेशन जितनी ज़्यादा हाई होगी उससे ज़्यादा हमें बहुत सारे इश्यूज होंगे। वो पॉपुलेशन सिर्फ एक जगह पे बढ़ रही है या फिर पूरे वर्ल्ड की पॉपुलेशन हो रही है, उससे सिर्फ नंबर नहीं बढ़ रहा है, उससे बहुत सारी चीज़ें और भी अफेक्ट होती हैं। लेट्स टॉक अबाउट दैट एवरीवन। सो हियर वी हैव द हाई रीजंस फॉर द here we have the high reasons for the high population rate. So let's take a look over here. First, there's a decline in the maternal mortality and infant mortality rate. Of course, high population का ये तो रीजन बहुत ही अच्छा है कि मदर एंड जो चाइल्ड है जो बॉर्न हो रहे हैं उनमें से उनका जो मॉर्टेलिटी रेट है वो अच्छा है। बेसिकली उनकी डेथ नहीं हो रही है, दे आर सर्वाइविंग, सो विच इज अ गुड थिंग। बट ऑफ कोर्स दैट इज एडिंग अप टू दी मोर पॉपुलेशन। पहले के टाइम पे आई एम श्योर यू वुड हैव हर्ड कि अनफॉर्चुनेटली देयर लॉस ऑफ 1 or 2 children during the delivery, or the mother would not be there because of course it's a very complicated process and the medical facilities was not there. But of course there's a decline in the mortality rate, or matlab there is a decline rate, which is very good, so that both the mother and the fetus, right, and the baby is surviving. Second important point that we have is the child marriages. Now because of the child marriages, we see that they are engaged in in having their early pregnancy, and that leads to more number of the children. And when they are married at a very not very mature age, they don't have the understanding about the body, about the finance, about the impact that the more number of children will have in their life or in the environment. So उस तरीके से भी child marriage is one of the reason, right, जिसकी जो cause करता है क्या, heavy population और high population. Third point is very connected to the child marriage, which is the illiteracy. अब भाई लोगों को नॉलेज ही नहीं है। फॉर एग्जाम्पल यू एंड आई, हम लोग बोल सकते हैं कि भाई हमको समझ है कि ज्यादा पॉपुलेशन अगर ग्रो करेगी तो जॉब हमें कम मिलेंगे, एजुकेशन अच्छी नहीं मिलेगी, हेल्थ केयर अच्छा नहीं मिलेगा, और ऑफकोर्स हमें बहुत इशू होगा। वी हैव द अंडरस्टैंडिंग क्योंकि हम पढ़ रहे हैं, हम समझ रहे हैं। पर अगर कोई इंसान जिसे नॉलेज नहीं है, ऑफकोर्स दे विल फील कि हाँ वी शुड हैव मोर नंबर ऑफ किड्स। सो इलिटरेसी इज ऑल्सो वन ऑफ द इंपॉर्टेंट फैक्टर कॉजिंग द हाई पॉपुलेशन। फिर आता है हमारा फोर्थ पॉइंट, विच इज दी प्रेफरेंस ऑफ अ मेल चाइल्ड। मेजॉरिटी like now of course in our country things have changed, but if you go back in 30 years back, right, in the families, right, the parents want a male child so that the male child will be able to carry their genes ahead and will be able to take care of the family, etc etc. और इसी reason से, right, parents will be trying to have if they have female or if they have the girl child, they will be trying more and more for the boys. Okay, so there was a preference of the male child. Then comes over the fifth important point, evasion of the family planning. People don't understand the importance of the family planning, right? And because of that also we see the high population rate. Last but not the least, we have sometime at various different places people are not aware about the contraceptive methods. They're not aware about the contraceptive as such. So they don't have any option, right? They're not aware about it. So they feel that, yeah, the production or the, giving life to a child is something which is very natural, and they keep on doing it for a longest time if their body permits. So again, ये सब reasons क्या हैं? ये सब reasons किसके हैं? High population के. इन सभी reason की वजह से high population होती है. Everyone, are we clear? I hope that all of you are clear, है ना? Give me a thumbs up everyone if you are clear with this. Awesome. यहाँ पे है बच्चों maternal mortality rate and infant mortality rate. The maternal mortality rate ratio is defined as a number of maternal deaths in the given time period divided by the number of live births. Okay? And same goes for the infant. Very good. So here we should have the understanding of these two terms. चलिए. So अब तक हमने पढ़ लिया पॉपुलेशन है, राइट, पॉपुलेशन क्यों बढ़ रही है, रिप्रोडक्टिव हेल्थ के बारे में पढ़ा, और हमने रीजंस भी समझ लिए कि भाई हाई पॉपुलेशन का रीजन क्या है। अब हम देखते हैं व्हाट आर द प्रोग्राम्स व्हिच आर रनिंग बाय द गवर्नमेंट, राइट, टू मेक पीपल अवेयर अबाउट द रिप्रोडक्टिव हेल्थ। लाइक लेट्स टॉक अबाउट इट. So there are programs to achieve the reproductive health in the India. In the 1951, right, India was the first country in the world to initiate such things, right? Initiate the action plan and the programs called as a family planning to attain the good reproductive health. Yes. हाँ बच्चे, दोनों पे 1000 पे होता है. See over here, दोनों पे 1000 पे. Okay. Now, इसके अलावा let's talk about कि what was their agenda, right? They thought that they'll be able to. Their main plan, I would say, was to have a better awareness about the sex-related matters, right? They are making people aware about the matters of the sex, right? Then of course, they are decreasing the decreased maternal and infant mortality rate is due to the increase of the medical assistance. अब फैसिलिटीज ज़्यादा अच्छी प्रोवाइड की जा रही हैं बाय द गवर्नमेंट, राइट? मेडिकल असिस्टेंस बहुत ज़्यादा है एट एवरी पॉइंट फॉर मदर एंड फॉर द न्यू बॉर्न बेबी. देर आर पीपल हु विल बी एबल टू टेक अ लुक एट देम. अगर कुछ इफ दे फील के कुछ सही नहीं है, दे विल बी एबल टू करेक्ट इट, दे विल बी एबल टू हेल्प देम. सो इसी तरीके से देयर इज अ डिक्रीज इन द मैटरनल एंड द इन्फेंट मोर्टेलिटी रेट ऑल्सो, क्योंकि मेडिकल असिस्टेंट अब काफ़ी ज़्यादा हो गया है. इसके अलावा द थर्ड इंपॉर्टेंट पॉइंट इज दैट इंक्रीजिंग नंबर ऑफ द कपल्स विद अ स्मॉल फैमिली. गॉन आर द डेज जब फैमिलीज में 4-5 बच्चे होते थे. नाउ वी आर लिविंग इन अ एज वेयर द स्मॉल फैमिली इज द बेस्ट फैमिली और द सुखी परिवार भी से. सो इसलिए भी पॉपुलेशन में थोड़ा सा कंट्रोल है. एंड ऑफ कोर्स ये जो प्रोग्राम्स हैं इसकी वजह से ऑफ कोर्स वी सी की कपल्स आर गोइंग फॉर अ स्मॉल फैमिली. देन ऑफ कोर्स ये जो प्रोग्राम्स हैं ये हेल्प करते हैं टू make people aware about the detection of the STDs, better detection of them and cure of them. They're making aware about the sexually transmitted diseases so that the people are aware about it so that they don't feel hesitant. या फिर उन्हें शर्म ना आए या फिर थोड़ा हिचकिचाए ना डॉक्टर के पास में जाने से, टेस्ट करवाने से. Then comes the last important point that we have the increased medical facilities for all sex-related problems. So now, of course, we have greater medical facilities that actually help in attaining a good reproductive health. So over here, everyone, you can take a screenshot and I'll share the PDF also with you after the class. What we have over here is the programs to achieve the reproductive health in the state of the India. Basically, how the government is taking some actions to help in increasing the reproductive health of the individuals. Okay, चलिए यहाँ तक सबको clear है? Good, very good. Now let's talk about the goals that we have for the reproductive health and the child health care. RCH. Now ये सब important है because wherever they have mentioned about the years become super crucial and super important. चलिए, what are the goals of the reproductive and child health care program? इनका क्या goal है, क्यों ये काम कर रहे हैं? RCH का main role क्या है? First of course, to introduce the sex education in the school. Primary schools में sex education को introduce करना, बच्चों को aware करना about the sex education, sex organs and tell them about the basic information that they needs to know. Moving further, we have the safe and hygienic sexual practices, telling them again more about it, spreading the awareness about the safety and the hygiene during the various practices. Then along with that, education of the sexually transmitted disease and AIDS. Along with the sex education in the schools, right? This is something which is there in our syllabus also. हमारे syllabus में भी we have the information about the sexually transmitted diseases, AIDS, right? So all of these actually help in making people aware about this. Then comes a fourth point, which is that bringing up the social consciousness of having healthy families or desired size. Small family, right? So these programs want to achieve or they want to spread the message to the people that if you have a small family, your family will be happy, right? So kind of adding that thoughts in their conscious mind so that they're aware about it. Moving to the fifth point, which is that creating awareness about the social evil life like sex abuse and sex-related crime. Now, majority of our time, especially in our country, we have seen that we read in newspapers that there are very various crimes that happen on a daily basis on girls or sometimes on boys also equally, right? Sometimes boys doesn't come out that much as girls do. They spoke about it, but we all know there's a lot of physical abuse that happens of the individuals. Now, if we are making it aware to the people, right, they can reach out to the bodies who will be able to help them further. So creating an awareness about the social evils and of course helping people who need the help. And the last point over here is that creating awareness about the reproduction with the help of the audio and the visual aid that can enable people to understand more about it, and then they will be able to make a better decision. So everyone, what we have over here are the normal important goals of the reproductive health and the child health care में जो guidelines हैं, the programs हैं, what is their intent, we have the information over here. Done? चलिए. Now let's talk about the steps taken to reduce the population size. Of course, again, see these parts are all very theoretical. हम जो बोले अगर अपने EVS language वाले हैं, So I'm just explaining you all the details we have in points, so it's easy for you to remember. And of course, I'll share the PDF. You can go back and you can take a printout. अगर आप खुद भी notes बना सकते हैं. What are the steps one is taking, right, to reduce the population size? Of course, motivating the small families, which is very obvious. Then, ban on the amniocentesis, right, the sex determination method. Then, of course, the age for the marriage has been changed for both male and the female, right? So, this is respectively changed in the male and the female, right, and which is very important. And the last one, giving incentive to the couples who have a small family. Along with that, of course, telling people or making people aware about the contraception method. So these are the steps taken by the government or by the various organizations to reduce the population size of a place. Easy? So अब तक हमने जो भी पढ़ा है वो हमारे पास points में है और बहुत ही similar points है, right? So I hope that you have the clarity of it. Yes, everyone, give me a quick thumbs up. जल्दी से बता दीजिए. We will be moving ahead. Yes. Uncan बच्चे, approximately, right, 3 to 4 questions can come from this particular chapter. Right? 3 से 4 आ सकते हैं. Okay? Yes, then you can calculate. Good amount. I still feel it's a good amount. चलिए. Now everyone will be moving into the details of it and we'll talk about the process which is the amniocentesis. Now again, it's a common question asked क्योंकि यहाँ पे से 2-3 हमारे MCQs question बनते हैं. Especially वैसे questions बनेंगे जिसमें हमारे पास में assertion and reason है. So we have the amniocentesis, right, which of course is a sex determination method, right, to legally check the increase the basically amniocentesis is a very easy process where what the doctor will be doing, they will be checking they will be inserting the needle, right, with the amniotic fluid which will be drawn out of the body and they will be testing it for any of the genetic disorder. Now of course इस test से parents को gender की भी information मिलती है. तो मोस्टली हमने ये देखा है इंडिया में कि बहुत सारे पेरेंट्स इस टेस्ट को करवाते हैं जस्ट टू नो वेदर देयर इज अ मेल और अ फीमेल चाइल्ड. अगर मेल चाइल्ड है तो उसे कुछ नहीं करेंगे एंड वेरियस टाइम्स अगर फीमेल चाइल्ड है एंड इफ दे डोंट वांट द फीमेल चाइल्ड विल सी द फीमेल feticide happening or the killing of the unborn fetus, right? So to avoid that, in our country it is legally, it's illegal to know the gender, right? No doctor can tell the gender of the baby, right? It is completely illegal, right? It's not legal at all. So everyone, I hope that you have this information. ये procedure use किया जाता है in the presence of the अगर कोई genetic disorders हैं या फिर if the parents wants to know whether the fetus have any of the genetic disorders or not. So बहुत सारे genetic disorders के लिए इस test को use किया जाता है. Very simple process. We know that the baby is present inside the amniotic fluid. तो syringe insert की जाती है, right, and that will be able to take some of the amniotic fluid and फिर उस amniotic fluid की testing होके based upon that they will be able to draw the conclusion कि number of chromosomes कितने हैं, whether the fetus is normal or do they have any of the genetic disorders. So that's about the amniocentesis. Yes, so that's one important topic that we have covered. Now we are moving to the main part of this particular chapter which talks about the contraceptive methods. अगर इस chapter में देखें तो majority of the portion is being covered by the contraceptive methods and then later we have in vitro fertilization and in vivo fertilization. So let's take a look everyone what we have. First let's start with the birth control and the contraceptive methods. So contraceptive method means, contra means against, right? Against the fertilization of ovum and the ovum by the sperm. So basically क्या कर रहे हैं, right? What are we doing over here? Contraceptive methods में there is avoidance of the basically meeting of the ovum and the sperm. We have various birth control measures, right? And of course we can have divided them into 3 different categories at which point it can help. First of course the ovulation phase, right? So the contraceptive methods, right, can actually work upon the ovulation phase and can reduce or can change the hormonal balance in the body to inhibit the ovary to release the ovum or to release it late, etc., etc. Then we have the fertilization. We know that it's a fusion, it's a process of fusion of the male sperm and the female egg, right? And after this only the zygote will be formed. If the contraceptive methods can work upon the fertilization time and not allowing the sperm and egg to meet, of course fertilization will not happen. Then the third place where the contraceptive works is on the implantation. We know that implantation is a process where the embryo will get embedded into the uterus. Embryo fallopian tube से आएगा and they will be getting attached to the uterus. तो of course अगर implantation की endometrium की thickening या फिर हम implantation को अगर थोड़ा सा भी affect कर सकते हैं तो of course it can act as a contraceptive methods. Take a screenshot everyone if you want to. So इस तरीके से we can say कि we have different types of birth control methods, right? And 3 different stages पे we can use them. Now let's talk about the characteristics of the ideal contraceptive. Now this is a very subjective, it's not very important over here, but we'll just go through it once. Characteristics क्या है best contraceptive के और ideal contraceptive methods के? First, it should be user friendly. Second, it should be easily available to the people. Should be very effective, right? Should not have any side effects. Should be reversible, right? Should have no side effects and should not interfere with the one's sexual drive. So all of these are the important characteristic features of the ideal contraceptive. Based upon that, we can categorize the contraceptive methods into the 2 main categories. We have reversible and irreversible methods. In reversible methods, we have barrier method, we have natural method also over here. That will come just fine now, Abhi. And then we have intrauterine device. And then in the surgical method, which are irreversible, that cannot be reversed. So, in the natural method, what we have? This is a very important thing, everyone. I'm sure you would have seen a question coming from this particular topic. Natural में क्या है? There's no use of the medicines or there's no method per se. But naturally, when the body की rhythm से, right, and based upon the body's condition, if the contraception is being is kind of used, it's a natural method. So first, of course, the first one that we have is the periodic abstinence, right? There's a rhythmic method, right? This is very crucial and very important in such way. Then, of course, we have the coitus interruptus, where, of course, there's a withdrawal method, where during the coitus, right, before the ejaculation, the male can draw back the penis. So, of course, the ejaculation will not be happening in the female reproductive tract. Then we have the lactational amnio, where, of course, during the lactation period, right, we know that the menstruation will also be not there. And, of course, during that time, right, can avoid the pregnancy also. So, over here we have the natural methods which are happening naturally. Then, we know that the contraceptive methods work on the principle of avoiding the meeting of the sperm and the ovum. सिंपल सी बात है, कॉन्ट्रासेप्टिव मेथड्स का एक मेन एजेंडा क्या है कि वो स्पर्म एंड ओवम को मिलने नहीं देना चाहते. They should not be the interaction between the sperm and the ovum, and hence we have these contraceptive methods. अच्छा बच्चों, I'll move aside. You take a screenshot of all of this, right? यहाँ पे हमारे पास में है periodic abstinence, right? Basically to avoid the to avoid the sex during the ovulation time. That will definitely be helping in avoiding the unwanted pregnancy. Drawbacks, कोई भी drawbacks नहीं है. Actual time of the only drawback that we have over here, okay, ovulation का exact time पता करना, it's a little bit difficult. एक दो दिन ऊपर नीचे रहता है. Then the characteristic features, it's perfectly, there's no involvement of the chemicals, so there's no side effects, there's no reactions, definitely irreversible, right, and it's easy. So of course, this is a very great method. Then we have the next method, which is the coitus interruptus, that is a withdrawal method. Male will withdraw the penis from the vagina before the ejaculation of the semen, and it will avoid the insemination. So of course, the semen is not going inside the female reproductive tract. अगर वो नहीं हुआ तो of course, right, we know that the chances of fertilization get very reduced. The drawback is that if some sperm enter the vagina before the ejaculation, that might lead to the pregnancy. And characteristic features, but they're absolutely correct for both male and this is for only males, right? Reversible, short-term hand, there's no side effects and very less efficiency. Coming to the next method, which is the absence of the menstruation cycle, right? During the lactation phase, when the mother is feeding the baby, right, we know that there's absence of the menstrual cycle, absence of ovulation also. So if during that time, right, if the contraception if if the parents want to avoid the contraception, this is the time. But of course, it's very less efficient. It's a natural method. Does not have any side effects though, but of course, efficiency is very less. Okay. So in a table form, we have it. You can take a screenshot also, or I'll share the notes. ये मैं बार बार बोलती रहूँगी कि screenshot भी ले लो, notes भी share कर लूँगी, लिख लो अगर लिखना चाहो तो. Anything which is comfortable to you, but notes आपके पास में होने चाहिए. तो अभी तक हमने डिस्कस कर लिया अबाउट द नेचुरल बर्थ कंट्रोल मेथड्स, है ना. अब हम बात करेंगे द नेक्स्ट वन विच इज द बैरियर मेथड. नाउ इन बैरियर मेथड क्या आएगा? अ बैरियर मेथड इज अ मेथड जो एक्चुअली अवॉइड करेगा द मीटिंग ऑफ द स्पर्म एंड द ओवम. सो वी हैव द स्पर्म ओवर हियर एंड इट्स अ बेसिकली काइंड ऑफ अ बैरियर एंड वी हैव द एग ओवर हियर. सो यहाँ पे आते हैं, वेरी इजी टू यूज दैट वी हैव that the ovum and the sperms are prevented from physically meeting, and they can easily prevent it by using the condoms, diaphragm, cervical cups, and the valves. Okay, so in sub, these all are the examples of the barrier methods. Now let's talk about them individually, everyone. Yes, Tirth Raj. Natural methods have no side effects, absolutely. Starting with the condoms, everyone. So of course, it's a basic information which is mentioned in our textbook and very crucial for us, that they are made up of the thin rubber or the latex sheet, right? They can be used before or during the coitus, prevent the release of the semen into the female reproductive tract, and of course prevent the fertilization. It plays a very important role in the in preventing the individual from the sexually transmitted diseases also. Then we have two different types of condoms in the market, which is one for male and of course for the males and for the females. So over here we have rolled, and basically they are showing you the picture of this, right? We have the female condoms, or also called as the femodoms, right? Now we have this note which is also there. This question was there in one of the year of the NEET examination. That is a Nirod, right? It's a condom brand which is manufactured in India, right? And of course it was there to make people aware about it, right? Chaliye. Then we have this particular part where we have spoken about. Give me a minute, everyone. Give me a minute, everyone. Yes, everyone, sorry for that, but yeah, here I am back. Chaliye. So we are clear with the condoms, right? Now, of course, we have over here that this is how the condoms will be acting as a barrier, right? They will be avoiding the meeting of the sperm and the ovum. What are the advantages of the condoms, right? We have various advantages. First of all, it prevents the user from the STDs and of the AIDS, right? Of course, helping in preventing the pregnancy, and along with that, it actually helps in preventing the or protecting the individual from the sexually transmitted diseases. Second point that we have over here is that it is easily accessible and it can easily be disposed of. It is available in majority of the medical shops, so people can go easily and buy them, and of course the throwing part is also very easy. Then it can be self-inserted, give the private privacy to the users. They don't need the involvement of any other individual, so it's easy for them to use it. Then we have definitely the fourth important reason, it prevents the fertilization, right? There's a prevention of the fertilization because of course ovum and sperm अगर मीट ही नहीं करेंगे तो fertilization नहीं होगी. And the last one does not interfere with the effects of the coitus. So of course it has no side effects on the process altogether. So we now understand that condoms are very much efficient in reducing or in decreasing the chances of having an unwanted pregnancy. Then of course they protect us from the sexually transmitted diseases. Moving to the female condoms that we have diaphragm, cervical cap and the walls, right? All of these are reusable, right? Of course for a short term, and cervical caps are reusable. Vault cap are there for the shorter duration, and of course diaphragm is just for the females. Now all of these are very important methods Again, they are made up of the rubber, inserted into the female reproductive tract, right? And kept for at least 6 hours after the coitus. It will be blocking the entry of the sperm, right? Along with that, we have the various different types of creams and jellies and forms that can be used along with these to act as the contraceptive methods, right? Yes, NEET is sufficient. Ritu, NEET is absolutely sufficient. Now everyone, here we have an extra information about the spermicides. Basically the sperm killing cream. We have spermicides cream, right? So of course these are the non-steroidal chemical formulation for the topical application, right? Contains the chemicals that will be preventing the pregnancy, right? By killing, blocking or slowing the sperm. So this cream, when applied, right, in the female reproductive tract, will be either killing the sperms or will be blocking them, or of course will be slowing the speed. And once all of this is there, fertilization will not be possible. These creams apply deep into the vagina and into the cervix, right? Just for 10 to 60 minutes, and that will be able to, you know, kill the sperms altogether. Okay? Chaliye. So that's one. We have spoken about the natural methods, we have spoken about the barrier methods, and now we are moving to the now we are moving to the next topic. Yes, cream can only be used, and we can use the cream separately also, and the individual can use it with the other barrier methods also, like with the diaphragm, with the cervical cap, etc. Chaliye. Yes, everyone. I hope my speed is fine for you. I can see so many of you are here. I don't want you to get distracted, and we're focusing on 100% CVSC content, right? CVSC, we had one more session which we have on the channel. You can go and watch the session also, jahan pe we have read the NCERT lines also. Okay, chaliye. Now let's move ahead to the intrauterine devices, right? Yes. Jagruti, please do let me know if speed is fast or less. All the students in the class, please do let me know if you feel that, ma'am, थोड़ा स्पीड ज़्यादा तेज़ है या फिर ज़्यादा कम है। तो बच्चे, हाँ, मैं बीच में हिंदी भी बोल रही हूँ, कोशिश कर रही हूँ हिंदी बोलने की भी बीच बीच में, और इंग्लिश और हिंदी का कॉम्बिनेशन है। चलिए, नाउ अगर हम बात करें इंट्रायूट्राइन डिवाइस की, तो वर्ड में ही हमें पता है कि हम किसके बारे में बात कर रहे हैं। इंट्रायूट्राइन डिवाइस बेसिकली एक ऐसा डिवाइस जो यूट्रस के अंदर रहेगा, राइट? यूट्राइन इज द यूट्रस, एंड ऑफ कोर्स वी आर टॉकिंग इन द इंट्रा, तो वो अंदर है। सो and very effective in a popular method जो contraceptive में है वो है IUDs, intrauterine device. These devices are inserted by the doctors or by the nurses, right, who are aware about the procedure, and these are ideal contraception for the females who want to delay the pregnancy or to have the space between the pregnancy, right? It is widely accepted method in the India. This is also a question which was there in the session and the reason. एक statement ये भी था. So it is one of the most widely accepted methods of contraception in India. This is a line there in the NCERT. So please NCERT एक बार आप देख लीजिएगा इस line को. Now let's talk about the IUDs. हमें पता है IUDs क्या हैं? They are something that will be inserted into the uterus of the female, and hence they will be controlling the flow of the sperms, or whether the sperms are active or not. We have 3 categories that we'll be discussing over here. First, we have non-medicated IUDs. Of course, they don't have any chemicals, right? There's not something which is there. Simple one, we have the Lippis loop, again made up of the plastic, right? Important thing, everyone, do take a note of this one, right? Very, very crucial and very important. Only one example. एक ही एग्जाम्पल है हमारे पास में, तो ईजी है हमारे लिए समझना. फिर हमारे पास में है तो जो मोस्ट कॉमन IUDs जो हमें मिलते हैं मार्केट में, उन्हें हम क्या बोलते हैं? कॉपर रिलीजिंग IUDs, राइट? वो कॉपर के बने रहते हैं. कॉपर की में हमारे पास में कॉपर T है, Cu7 है, फिर मल्टी लोड 337 है, सॉरी 375 है. तो यहाँ पे क्या है, इनमें हम ये जो है IUDs है कॉपर रिलीज करेंगे. कॉपर रिलीज करेंगे तो वो अफेक्ट करेगा स्पीड ऑफ द स्पर्म एंड उनकी फर्टिलाइजिंग कैपेसिटी. एब्सोल्युटली करेक्ट है ना? तो अगर कॉपर टी या फिर कॉपर IUDs अगर यूज करे हुए हैं फीमेल ने, तो क्या होगा? अगर स्पर्म एंटर करें तो उनकी स्पीड कम होगी एंड मोस्टली उनकी जो फर्टिलाइजेशन कैपेसिटी है वो भी रिड्यूस होगी. तो दैट इज द एडवांटेज ऑफ द IUDs. थर्ड में आता है हमारे पास में हार्मोनल IUDs. अब ये हार्मोन्स हैं, राइट? बेसिकली यहाँ पे 2 हमारे पास में हार्मोन्स हैं. ये हॉर्मोन्स रिलीज होंगे एंड दे विल बी मेकिंग यूट्रस not so suitable for the fertilization या फिर sorry for the implantation, not for the fertilization, and cervix will hostile to the cervix environment, very hostile to the sperm, so आ ही नहीं पाएंगे, right? Clear? And even if they enter, they'll not be able to survive. We have two examples of it, LNG20 and we have progesterone, right? Both of these are what? Hormones, right? And इनका क्या effect पड़ रहा है? Absolutely correct. So बच्चों यहाँ तक हमें clear है, हमने पढ़ लिया natural methods, हमने पढ़े बैरियर मेथड्स, और अभी हम पढ़ रहे हैं क्या? अभी हम पढ़ रहे हैं IUDs. ऑल ऑफ यू, आर यू क्लियर अप टू हियर? बताइए, यहां तक हम सबको क्लैरिटी आ गई ना? यस यस, वेरी गुड वेरी गुड, बढ़िया है ना? चलिए, ऑसम. नाउ क्रिस्टल क्लियर, वेरी गुड वेरी गुड, फील्स गुड जब आप ये बोलते हैं तो. Okay, let's take a look at the question, everyone. Here we have, which of the following is a correct statement? This question came in the year 2019 के ओडिशा वाले उसमें था. यहाँ पे हमारे पास में क्वेश्चन है, इसमें से कौन सा स्टेटमेंट सही है? स्टेटमेंट हमारे पास में 4 हैं. IUDs suppress the gametogenesis. IUDs once inserted need not to be replaced. IUDs are generally inserted by the user herself. और IUDs increase phagocytosis of the sperm in the uterus. हमें करेक्ट स्टेटमेंट पिक करना है. वेरी गुड, यस, ऑप्शन नंबर डी इज द करेक्ट आंसर. IUD सप्रेस गैमेटोजेनेसिस नहीं, वो तो अलग ही बॉडी में हो रहा है, तो ऑफकोर्स स्पर्म की फॉर्मेशन को कोई इफेक्ट नहीं करेगा. देन वी हैव IUDs once inserted needs not to be replaced. नहीं, IUDs को रिप्लेसमेंट चाहिए होता है बेस्ड अपॉन द इयर्स, राइट? इधर 1 year 2 year 3 years के बीच में उनको रिप्लेसमेंट चाहिए रहता है. IUDs are generally inserted by the user itself. No, it was inserted by the a doctor or a nurse who is been practicing this, right? Who is well aware about the the procedure. So the correct option that we have over here is this. The use of the intrauterine device will increase the phagocytosis of the sperms in the uterus. चलिए, so we have spoken about this, everyone, right? यहाँ तक क्लियर है सबको? अब हम बढ़ते हैं to the next topic of the chemical contraceptive methods. Yes, expert nurse also. Absolutely correct, देवांशी. अब हम बात करेंगे हार्मोनल मेथड्स की, राइट, जिसमें केमिकल्स का इन्वॉल्वमेंट है. तो केमिकल कॉन्ट्रासेप्टिव्स आर ऐसे कॉन्ट्रासेप्टिव मेथड्स हैं जहां पे केमिकल्स को यूज किया जाता है टू प्रिवेंट द ओव्यूलेशन, फर्टिलाइजेशन या फिर इम्प्लांटेशन. 3 चीजों पे हमने स्टार्टिंग में पढ़ा था ना कि ओव्यूलेशन पे वर्क कर सकते हैं कॉन्ट्रासेप्टिव मेथड्स, फर्टिलाइजेशन पे या फिर इम्प्लांटेशन पे. तो जो हार्मोनल या फिर केमिकल कॉन्ट्रासेप्टिव मेथड्स हैं वो इन तीनों एरियाज पे वर्क करते हैं. स्टार्टिंग विद द हार्मोनल स्टेरॉइड्स, राइट, या फिर हार्मोन्स है हमारे पास में, फिर हमें स्टेरॉइड्स बोलते हैं. तो यहाँ पे हमारे पास में स्मॉल डोज, राइट, स्मॉल डोज ऑफ प्रोजेस्टेरॉन अलोन वी कैन टेक, राइट, या फिर अ डोज ऑफ द प्रोजेस्टेरॉन एंड द ईस्ट्रोजन टुगेदर गिवन टू द वुमन. ये क्या करेंगे, ये जो हार्मोन्स डायरेक्टली ब्लड स्ट्रीम में जाएंगे, राइट, एंड ऑफ कोर्स विल हैव अ वेरी एडवर्स इफेक्ट. प्रोजेस्टेरॉन रिलीज करेगा इफेक्ट सिमिलर टू द प्रोजेस्टेरॉन, इनहिबिटिंग द ओव्यूलेशन एंड द इम्प्लांटेशन एंड thus preventing the pregnancy. So ये प्रोजेस्टिन जो है, देखो डिफरेंस है बच्चों स्पेलिंग में. प्रोजेस्टेरॉन जो नॉर्मल फीमेल हार्मोन है, यहाँ पे स्मॉल डोज ऑफ प्रोजेस्टिन, राइट, स्पेलिंग अलग है, हम वो ऐड कर रहे हैं फीमेल रिप्रोडक्टिव सिस्टम में. तो क्या होगा, इनहिबिट करेगा, क्या इनहिबिट करेगा ओव्यूलेशन को या फिर इम्प्लांटेशन को. तो ये एक इफेक्टिव मेथड हो जाएगा. यस, ओके, लेट मी जस्ट रीड फ्यू कमेंट्स. नीट एस्पिरेंट बच्चे, आई नो इट कुड बी अ हार्ड टाइम आज, डोंट फील कि ना ऐसा लग रहा है. आई नो देयर विल बी अ टाइम, बट कम ऑन, होल्ड योरसेल्फ बैक, है ना, सॉरी, पुल योरसेल्फ बैक एंड स्टार्ट लर्निंग. आज रेस्ट कर लो, कोई दिक्कत की बात नहीं है, पर आपको पता है कि पढ़ाई करना जरूरी है ना, तो प्लीज बी अवेयर अबाउट इट. NCERT बच्चे, Taylor, please do read the NCERT. Thank you, NEET aspirant, for helping your friends out there. Okay, चलिए. Next, let's talk about the non-hormonal or the non-steroidal method. Of course, हमारे पास में hormones में अभी हमने बात करी इसकी combination की. So let's take a look, everyone, over here also. We have these two hormones, right? We have progesterone and the estrogen, and of course, we have the hormonal chemical contraceptive release of the progesterone, right? Gestogen, right? Of course, this is how we can pronounce, and the estrogen. Here we have, किस तरीके से एक्ट करेगा? देखिए, प्रोजेस्टेरोन, राइट, किस तरीके से एक्ट करेगा? इट विल बी एक्टिंग लाइक अ प्रोजेस्टेरोन, वैसे ही एक्ट करेगा, इनहिबिट करेगा हमारे गोनाडोट्रोपिन रिलीजिंग हार्मोन को फ्रॉम द हाइपोथैलेमस, यानी कि जो एफएसएच और जो एलएच हार्मोन सिक्रीट कर रहे थे उनकी रिडक्शन, उनके इनहिबिशन, उनकी स्टिमुलेशन पे इनहिबिशन लगाएगा, राइट? फिर जब कोई वी डोंट हैव द गोनाडोट्रोपिन रिलीजिंग हार्मोन, एफएसएच एंड एलएच नहीं होंगे, एफएसएच नहीं है तो फिर ऑफ कोर्स फॉलिकल डेवलप नहीं होंगे इन फीमेल्स, राइट? और एलएच नहीं है तो एलएच सर्ज नहीं आएगी, ओव्यूलेशन नहीं होगी. सो इस तरीके से ये दोनों हार्मोन्स प्ले अ वेरी इंपॉर्टेंट रोल इन reducing the chances of the fertilization, ovulation and the implantation. Clear? हाँ, ओव्यूलेशन को प्रिवेंट करेगा, एब्सोल्युटली. ईस्ट्रोजन नहीं है, प्रोजेस्टेरॉन नहीं है तो ऑफ कोर्स आगे, अगर प्रोजेस्टेरॉन नहीं है तो ऑफ कोर्स वी नो के आगे मेंटेनेंस तो प्रेगनेंसी नहीं हो पाएगा, और अगर ईस्ट्रोजन नहीं आया तो हम एलएच सर्ज भी नहीं आया तो ओव्यूलेशन नहीं होगी. नेक्स्ट एवरीवन, वी हैव द एस्ट्रोजन, राइट? ये क्या करेगा? इट विल बी कंपनसेटिंग एंड मेंटेनिंग अ नॉर्मल थिकनिंग ऑफ द यूट्राइन वॉल, राइट? एंड प्रिवेंट द इनरेगुलर ब्लीडिंग, menstrual bleeding. Yes? हाँ अश्विनी, एंटागोनिस्ट भी नहीं बोल सकते. वी कैन से कि उतना नहीं, वो बेसिकली उसके अगेंस्ट में नहीं, वहां पे जाके उसको इनहिबिट ही कर रहा है. इट विल सेंड द सिग्नल, राइट? इसकी हाइपोथैलेमस में जाके बोलेगा कि भाई गोनाडोट्रोपिन रिलीजिंग हार्मोन की हमें जरूरत नहीं है. मेंस्ट्रुएशन विल बी देयर, यस जागृति, मेंस्ट्रुअल साइकिल विल बी देयर. ओके, चलिए. Last but not the least, everyone, we have the hormonal chemical methods. में we have different types like pills, injections, and the implants. ये तो हो गए oral pills, right? Of course, we can take in this particular way. And let's talk about the contraceptive pills now. Everyone, let's talk about the contraceptive pills. Now, when we talk about the contraceptive pills, they are being taken orally, right? Medicines की तरह ली जाते हैं ना, small dose of the progesterone or the combination of both the hormones, right? ये pills have to be taken up daily for a period of 21 days starting from the first 5 days of the menstrual cycle. Gap होना चाहिए of 7 days, right? And again they can start a repetition of it. ये pills actually क्या होता है? They will be inhibiting the ovulation and the implantation. Ovulation रोकते हैं, implantation रोकते हैं, and of course they alter the cervical mucus that are present in the uterus. So basically वहाँ जो cervical mucus भी है, जो उसकी entry point पे है cervix के, वो वहाँ का जो mucus है उसको भी change कर देते हैं, उसकी जो quality है वो change हो जाती है ताकि it can prevent or block the entry of the sperms. दूसरा, pills are very effective and have very less side effect, okay, which are widely used in the country. Then we have another, which is the one of the common word I'm sure you would have heard about is the Saheli. Once in a week, it's a non-steroid contraceptive pill which actually help in blocking the ovulation, right? And of course, it has very few side effects and a high contraceptive values. Yes, it was developed at the Central Drug Research Institute, CDRI in India. Ashwini ma'am, please, aren't they coinciding? Question point 2 and 3. नहीं, वो सेम नेक्स्ट मंथ का बोल रहे हैं, राइट? वो बोल रहे हैं दे आर टॉकिंग अबाउट द नेक्स्ट मंथ. ओके, चलिए. Okay everyone, then we have the implants, right? Then we have the implants, patch and the injection. Implants में क्या होगा हमारे पास में? See over here we have the injections. Hormonal injection होगा with the combination, right? And of course patches हैं या फिर implants हैं, we can place them under the skin and they'll be releasing the hormones. तो उससे उसका effect body में आता जाएगा. Thermal patches again, we can easily apply them from externally, not from the inside, right? चलिए. So we have discussed about the IUDs also. Everyone, are we clear? Everyone, please do drink water if you need. Give me a minute. Yes, बच्चे पानी पीते हैं ना? ओके, थैंक यू सो मच टेलर. सो वी हैव डन, अभी तक हमने अच्छे से पढ़ाई कर ली है अबाउट द नेचुरल मेथड्स, बैरियर मेथड्स, hormonal methods, IUDs. Now the last one that we have in the contraceptive methods is the surgical contraceptives. मैम ये ट्रांसडर्मल समझ में नहीं है तो हाँ बच्चे, सो बेसिकली ये जो ट्रांसडर्मल रहते हैं, फॉर एग्जाम्पल इफ ये प्लेसिंग इट ऑन द स्किन, राइट, तो ये ऑफकोर्स ये क्या है, इम्प्लांट्स हैं, या फिर जो हमारे पास में ये जो पैचेस रहते हैं, व्हाट दे विल डू, दे विल रिलीज दी हॉर्मोन्स. मतलब ऑफकोर्स इनका कनेक्शन बहुत क्लोज है ब्लड स्किन के साथ में, तो ऑफकोर्स इजिली जाएगा अंदर, राइट, एंड दे विल बी रिलीजिंग द हॉर्मोन स्लोली इनटू द ब्लड. उसका इफेक्ट पड़ेगा, एंड ऑफकोर्स हमें पता है कि ब्लड के थ्रू ही हॉर्मोन्स जाके ट्रैवल कर रहे हैं, दे विल बी गोइंग टू द टारगेट साइट. यस तीर्थराज, आई होप दैट इट्स क्लियर बच्चे. Yes, Tirthraj, I hope it's clear. Chaliye, okay. Now let's talk about the surgical contraceptive methods, right? In surgical contraceptive methods, we have two. We have tubectomy and we have vasectomy. Surgical methods कैसे हैं? जो that will be blocking the passage of the gametes, right? जो block करेंगे gametes का transportation और prevent करेंगे conception. इनका reversibility नहीं है, poor reversibility है. First, of course, let's talk about the vasectomy. Vasectomy is done in the males where the vas deferens is cut and tied, right? Method is for the male sterilization. It will prevent the transport of the sperms. Testis से sperms बनेंगे, testis में sperms बनेंगे, but they will not be able to leave the, they will not be able to reach to the duct, right? They will not be moving ahead. So this is important. Then, of course, we have some of the part of vas deferens is removed and, of course, tied together. Then we have tubectomy, which is, of course, happens in the female fallopian tube, where, of course, the transportation of the ovum is kind of restricted, right? And, of course, this both methods are irreversible. There are few side effects of it. अगर procedure अगर properly नहीं हुआ, so can affect, but mostly they are irreversible. Yes. नहीं बच्चे, इम्प्लांट्स रहते हैं, सर्जी जो पैचेस हैं वो तो इजीली, जैसे कि इंसुलिन पैचेस भी आपने पढ़े होंगे, राइट, इजीली कैन बी एडेड. इम्प्लांट्स, यस, इम्प्लांट्स डेफिनेटली नीड अ मेडिकल असिस्टेंट, बट जो पैचेस लगाने ऑन द टॉप ऑफ द स्किन ये इजीली भी लगाए जा सकते हैं. यस, नीड एस्पिरेंट. यस, चलिए, okay. Okay, next question everyone. चलिए, moving to the next part. We have the question over here. We have to the list A and we have list 1 and 2. Everyone, we have to match. List 1 यहाँ पे है, list 2 यहाँ पे है. This question came in the year 2021. Please, let's match it up. We have walls, IUDs, vasectomy, tubectomy. फटाफट से मैच करते हैं. See, vasectomy and tubectomy are the hint over here. Vasectomy, right? Removal of the vas deferens. Tubectomy and tubectomy is the removal of the fallopian tube. IUDs, right? And then of course we have the IUDs, which are the phagocytosis of the sperm within the uterus, and valves, right, which stop the entry of the sperms through the cervix, which is blocked. So option number C is the correct answer. Very good, everyone. Option number C is the correct answer. Very easy. Chaliye. Next question, everyone. What is the function of the copper ions, or what is the function of the copper ions in copper releasing IUDs? क्या function है? सबसे पहले आपने आंसर दिया. वेरी गुड, बढ़िया है नीट एस्पिरेंट. जल्दी बताइए बच्चों, क्या है फंक्शन ऑफ कॉपर आयंस इन दी कॉपर रिलीजिंग आयोडीज? बिल्कुल, ऑप्शन नंबर ए. सप्रेस करते हैं स्पर्म्स की मोटिलिटी को और फर्टिलाइजिंग कैपेसिटी को. वेरी वेरी गुड, राइट. ये सब बाकी रीजंस गलत हैं, यही हमारा रीजन सही है. वेरी गुड एवरीवन. सो अब तक हमने पढ़ लिए अपने सारे कॉन्ट्रासेप्टिव के मेथड्स. हमने क्वेश्चन भी सॉल्व कर लिए थोड़े से. हम आगे और क्वेश्चन सॉल्व करेंगे. 2 टॉपिक्स बचे हैं. लेट्स क्विकली फिनिश देम. Right? Now let's talk about the medical termination of the pregnancy. There are times जहां पे पेरेंट्स को पता चलता है that the baby or the growing fetus has a genetic disorder, and probably the life of the baby or the fetus will not be that great. So they can approach to the court for the medical termination of the pregnancy, right? This is not, kind of time-taking process, but of course the government is, or it's kind of where the, we have the legal procedure for this. Intentional or voluntary termination of the pregnancy before it completes term, we call it as the medical termination of pregnancy, MTP. Medical termination of pregnancy or the induced abortion. 20% of the total pregnancies are aborted, right, that we have in the stats, can be safely performed up to the 12th week within the first trimester only of the pregnancy. Risk rehta in the second trimester. Now, medical termination pregnancy, we have an act which came in the year 1971, which was brought by the government of the India, right, to unnatural maternal death, to avoid the unnatural death, maternal death due to the unsafe abortions. Of course, we have this act. Based upon that, the individual can undergo the process, but of course, there are certain norms, and the doctors and the hospitals will be following a certain procedures, right? There will be a lot of paper filling, there will be a lot of understanding and discussion that why the parents wants to abort the child. Once they have a very concrete reason, very solid reason, then only they'll be aborting, okay? Based upon the information only, yes. Then we have this information which says that the Medical Termination of Pregnancy Amendment Act, which came again in 2017, was enacted by the government of India. According to this act, everyone, this is important. These questions are there in the accession and reason. ये ऐसे questions आ सकते हैं. According to this particular act, pregnancy may be terminated on a certain conditions ground within the first 12 weeks of the pregnancy on the opinion of the registered medical practitioner, right? Of course, a doctor who is aware about the things, right, he only can suggest to go for the, if there are any conditions across. And if the pregnancy lasted for more than 12 weeks but fewer than 24 weeks, two registered medical practitioner, right, should give their opinion for the medical termination of the pregnancy. So here we have this all knowledge, right? Chaliye. Then we know that why they have made it illegal, right? And of course, because we have seen various illegal activities. Because there are a lot of unqualified people who will be, in the name of telling the gender, right, they will be practicing these things, and they is completely, not good for the mother, for their health for sure. So, of course, these are the things that you will remember. Then we have the other things. We have the fatal sex determination followed by the medical termination of the pregnancy, right, where the female feticides, if the parents know that, right, that the child that they're carrying is a female, they try to abort it, right? So, of course, female feticide is one of the common thing that we have seen, and it's an illegal practice. And hence, the medical termination of the pregnancy, the MTP, is performed only under the guidance of the doctor and based upon the reports and the research on the research. If we talk about the sex determination, amniocentesis is definitely there, and we have the ultrasound scanning, but both of these will not be disclosing the gender of the child to the parents, right? Yes. And of course, with the last point that we have over here, if the fetus is found to be the female, then the MTP is undertaken by the couple, which is totally against the law. Okay? Clear, everyone? So what we are discussing over here is that about the misuse of the technology sometime, right? Misuse of the medical termination of the pregnancy. Yes, Anu, we are discussing the chapter which is Reproductive Health of class 12th. Chaliye. So this topic is done, everyone. We have spoken about the medical termination of pregnancy. Yes, now let's move to the easy peasy topic which have so many names and you have to remember all of them. Where we have the sexually transmitted diseases. Now these are the diseases which are caused from the infected individual to the healthy individual, right? So we have the different causative agent, we have types and the diseases. So everyone please do pay attention to this. NEET aspirant bache, it's a question, you have a very valid question and a very valid observation. But in a case, right, of course, they have made it illegal because there are times when the pregnancy, for example, in a case of ectopic pregnancy where the embryo is implanted into the fallopian tube, that is definitely not healthy for the mother, right? The mother will be suffering later. So probably in such decisions, in such conditions, these decisions are being made. Okay, everyone, we have the causative agent, which is bacteria, causes gonorrhea. We have syphilis. Remember the name of the organism, everyone. इसमें question clearly आता है. भाई NCERT is enough for our bio. NCERT itself पूरा sufficient है, right? आपकी टेक्स्ट बुक में मेंशन किया हेपेटाइटिस बी के बारे में. What are the treatment that we have over there, right? See over here, everyone. It's acute and of course chronic. बहुत acute means short term के लिए, chronic means long term के लिए. Transmission किस तरीके से हो सकता है? By the blood transfusion, organ transplant, infected needle use करने से या फिर from the mother to the baby. Symptoms are jaundice, vomiting, fever, headache, weakness and the pain in the left part of the abdomen. So the common symptoms, right, of the hepatitis B. AIDS के बारे में हमने पहले ही पढ़ा हुआ है. AIDS of course is caused by the virus, right, and of course it will be there in the body for so many years, but will be, visible after years altogether. Has sore throat, itchiness, compromised immune system. All of these are the few of the symptoms that we have in the AIDS. Okay, so we have two of these diseases. Now I know that I want you to take a look over here and then we'll move to the question. As of now, it is. Chali everyone, please do look over here. So we have gonorrhea, right, which is caused by the bacteria, which is Neisseria gonorrhea. Then we have Treponema pallidum, which cause the disease, which is the syphilis. It's a bacteria. Then we have herpes simplex virus 2 type, HSV2, that causes a virus that causes genital herpes. And we have human papillomavirus, which is HPV virus, and it causes the genital wart. We know AIDS is caused by AIDS is caused by the HIV virus, right, which is the human immunodeficiency virus. And of course, AIDS is a huge name for that, right? And hepatitis B by the hepatitis B. Yes, here we have the information. Okay. So now that we have, everyone, can we take a look at the question? Can you quickly match it up? We have column 1 and we have column 2 and we have to pick the correct answer. Yes, very good. Let's quickly match it up, everyone. AIDS ka easy, human immunodeficiency virus, right? Then we have the gonorrhea. We have the name gonorrhea. We have syphilis, pallidum. Then we have the genital herpes. Okay? Based upon that, option B is the correct answer. Very good, everyone. Very, very good. So this is done. Awesome. Okay. Now let's move ahead, everyone, to the next topic that we have, right? So all of these questions are PYQs. Now let's move to the next question, which is the early symptoms of the STDs and the complication. So of course, in the early symptoms of the sexually transmitted diseases, there's a itching, slight pain, fluid discharge of the swelling in the genital parts, right? Proper care and proper medical attention have been given. The effects can be definitely be reduced. Some of the diseases like, right, can be, of course, HIV and the other diseases, right, cannot be cured completely. But there are few diseases which can be cured, right? But not fully, but definitely prevention is better than the cure. So this page talks about that, okay? Then of course, if we talk about, we have a lot of social stigma around these, right? We don't feel comfortable in talking about these diseases and we are kind of feel not so aware about these diseases and spreading the information about. So we have all of these infections which are there and we should be aware about it. We should be removing the social stigma around the sexually transmitted diseases so that the individual can come out and can go to the doctor for the treatment, right? So we should be very supportive of the patients, of the conditions that they all are in, right? Apart from that, everyone, we have the prevention of the, sexually transmitted diseases. First, of course, we have spoken about the barrier method is the most effective method. Then we have having a conversation with the qualified doctor. Using the fresh syringe every time, should not be using the needle which is used by the other individuals. And of course, fresh blade also some. Anything which can have a chance of contacting the body fluid, we should be avoiding that, right? Chaliye. Good evening, Comfy Studies. Good evening. Yes. Yes, Ritu. Ha, absolutely. Ha. Very good. Chali, everyone, are we clear with this? Are we clear with this part? It's basically the part where we need to, express our views on the various, conditions that we have. इसमें से क्वेश्चन आने का चांसेस कम है, और अगर आए भी तो इट्स मोस्टली assertion and reason based question. चलिए. Okay, next everyone, the last topic that we have, which is the assistant reproductive technology. ART, right? Assistant reproductive technology. So that there are so many couples, right, who will not be able to conceive. For them, we have various technologies which came into the market that are there to help the individuals. First, yes, we have it. Yes, everyone. Here we have, let's quickly take a look over here, assistant reproductive technology. We have, basically, there's a set of the medical procedures which are there, and that will be helping the individuals to treat the infertility. First, of course, we'll be discussing about the in vitro fertilization. In vitro, right, inside the test tube that we say. So, of course, what we'll be having over here, it's basically the fertilization that is happening. Of course, we have the sperm that will be injected into the egg, right? And of course, after that, the fertilization will be there. The growth will be happening in the test tube only, and later the embryo transfer will happen. We have two types over here: zygote, intrafallopian transfer, where the zygote is transferred into the fallopian tube, and then we have intrauterine transfer, जहाँ पे uterus में transfer कर रहे हैं. See everyone, the names are giving the indication के क्या हो रहा होगा. In vitro fertilization में we have zygote in vitro transfer, happening the transfer in the fallopian tube, and where on the other we have the intrauterine transfer, easy, that is happening inside the uterus. Now, the other one that we have is the in vivo fertilization. In vivo fertilization mein what is happening? Gamete transfer is happening, right? Clear? So we'll discuss about it. We have three important examples. Yes. Pakka? I just need 10 more minutes. How? Okay. So everyone, we have in vivo fertilization with gamete transfer, and of course we have three important parts over here. We have the gamete intrafallopian tube transfer, which is very good. Yeah, gift. Right, and then we have gift also. We'll talk about it. We have artificial insemination, and we have intrauterine insemination. So let's take a look over here. First thing first, everyone, we have in vitro fertilization. What happens, this fertilization is performed outside the body of the female in a very similar condition, we can say. That is the reason we call it as a test tube baby program also. Now, what will be happening over here? The ovum from the wife or from the donor will be collected, and the sperm from the husband or the donor will be collected. They will be collected, and the fertilization will take place in the lab conditions. Upon the fertilization in the lab conditions only, we will see that there is a formation of the embryo. This embryo will be transferred either into the fallopian tube, right, or into the uterine or into the uterus. Now, there are two methods over here that can be incorporated. First is the intracytoplasmic sperm injection. Sperm will be directly injected into the ovum. Okay. If we have less amount of the sperm, that sperms can be directly injected into the ovum, right? Of course, one will be there. And it is done of a low sperm count, of higher concentration of the deformed sperms, and the low sperm motility. Then with the other method we have is the embryo transfer. After we have the embryo which is formed, it can be easily transferred, right? Zygote, intrafallopian transfer. Zygote will be transferred to the zygote will be developing into the embryo, and this embryo can be easily transferred into the fallopian tube. Then the other one we have is intrauterine transfer, where the embryo will be transferred into the uterus for the implantation. Everyone, I hope that it's clear to all of you. I hope I'm not talking to the walls, but I hope that you're paying attention, right? And the last one we have is the surrogacy, where of course it needs a lot of legal arrangement, where women will be carrying the baby in their womb, but they will not be the mother, right? The implantation will be happening over there, the development will be happening, but the fertilization will be there of the another parent. Okay, that is surrogacy. Yes, zygote in intrafallopian transfer and the intrauterine transfer. Okay, now the next one we have is the in vivo fertilization. Fertilization which is performed within the body, in vivo, inside the body, in vitro, outside the body. So in vivo fertilization, what will be happening? Fertilization requires donor of the sperm and the egg. Let's see what are the procedure. First, gamete intrafallopian transfer. The gamete will be transferred, right? Is it performed in a case of female if they are unable to produce the egg, right? So gamete will be transferred. Then of course we have artificial insemination, performed in a case of the males if the sperm quality is not that, if the count is low based upon the conditions, the artificial insemination will be happening. Okay. Last and the last one that we have over here is the intrauterine insemination. It is performed if the vagina is too acidic or the pH of the semen is not alkaline. In that particular conditions, what we will see? We will see that sperms will be directly placed into the uterus artificially. Right? Clear? Very, very good. Yes. Tetracham surrogate mother means ovum donor. We can say sometimes they are just the carrier, right? Sometimes parents, if they wish, if they can, conceive, they want to develop the, zygote, or basically the embryo will be formed and they will be transferring it to the surrogate mother. Or sometimes the surrogate mother can be the ovum donor also. Okay? Yes. Okay. Chaliye. So with this everyone, we are done. Let's quickly solve some questions. Chaliye. If you have few questions, let's quickly solve. Ma'am, what is the difference in the disability when disability? Well, I didn't get your question. Okay, what are the chances of their failure? Artificial insemination may, Ashwini, these sperms are being added into the female reproductive system. But in the IC, that is the intracytoplasmic sperm injection, the sperm, the genetic material is directly inserted into the ovum. Chaliye. Okay, very good. Which of the following are the techniques for the in vivo fertilization? Absolutely correct. Option number C. Artificial insemination and the intrauterine insemination. Good. Here we have the discussion points also. Again, you can take a screenshot every one of this. Okay, very, very good. Chaliye. Now everyone, we have some practice questions, so I hope that all of you are ready. Ready, right? Chaliye. Here we go with the very first question. Reproductive health means a total well-being in all aspects of the reproduction, that is physical, emotional, behavior and social. This is the definition given by. Easy peasy everyone, quickly answer. Very, very good. Option number C is the correct answer, that is the WHO. WHO have given this definition of the health. Very good. Yes, WHO. Now moving to the next question that we have over here. All of the giving statement are true with respect to the technique that involves the extraction of the amniotic fluid of the developing fetus, except. So basically what we're talking over here, we're discussing about the amniotic fluid and of course the process of did I say the name of the process? We have to find out which is correct, right? Over here. Yes. We have to find the one incorrect statement. It is definitely used to test the presence of any sickle cell anemia, basically any genetic disorder. It is used, there is a sanitary ban on this technique in India to check the female feticides. And it cannot be detect metabolic disorders like jaundice. This is the correct answer over here. It is used for the paternal sex determination. No. Good. Okay. Next question everyone. We have statement A and statement B. Statement A is better awareness about the sex-related matters, increased number of medical termination of pregnancy and better detection as well as the cure of the STDs indicates improved reproductive health of the society. Statement 2 is that to attain a total reproductive health as a social goal, family planning program was initiated in the year 1961 in India. Tell me everyone. 1961 में तो नहीं हुआ था, 1951 में हुआ था. We have spoken about that, right? So statement B is incorrect for sure. Better awareness of sex related and increased number of medical termination of pregnancy. नहीं, that is not. Increased number of termination of pregnancy is not the correct thing that we have. So option number B is the correct answer. Both the statements are incorrect. Right? Better awareness about the sex-related matters, increased number of medical termination of pregnancy, and better detection, as well as the cure obviously indicates improve. I'm not sure about the increased number, right? B will be the correct answer. Right? Increased number of medical termination of pregnancy is not a good indication. Okay? Chaliye. Okay. Next question, everyone, on your screen. Again, we have accession as a reason. A new oral contraceptive for the female developed at the CDRI, Lucknow, prevents the conception by inhibiting ovulation as well as the implantation. The reason for this, they are saying, is that this oral contraception increases the availability concentration of the progesterone in the blood within the maintains the endometrium. Pick the correct answer, everyone. Yes. Yes, everyone. What is the correct answer? Arey, why are you saying A? The new oral contraceptive for the female developed by the CDRI, Lucknow, prevents the conception by inhibiting ovulation as well as the implantation. Is it correct or incorrect? The reason is that, first of all, we have to find out whether the statements are correct or incorrect. The oral contraception increases the available concentration of progesterone in the blood. No, which maintains. That should not be the case, right? Okay, why you are saying that both the statements are correct? Everyone, do read the statement carefully. Dobara se ek baar statement padhiye and open your NCERT. What is the main role of the drug which is made by the CDRI, Saheli, right? It has no role in the implantation. It has just an important role in the ovulation. So, that statement is absolutely incorrect. This statement that this oral contraceptive increase the available concentration of the progesterone in the blood which to maintain the endometrium, nahi. That is not the case. So, option number D is the correct answer. Very good. Both the statements are incorrect. Very, very good. It took you some time, but sahi hai. De raha hai, durust hai. Now you have the correct answer. Chaliye. Moving to the next question, everyone. Okay. I think by the word lactation only we'll be able to find out that what we are talking about is a natural method of the contraception and it is only effective up to what period of time? Very good. 6 months following the pasteurization, basically the delivery. Very good. So option number A is the correct answer. Next question, everyone. We have one more question and then we'll be ending the session. So come on. This and after this we have one more question. Chaliye. Mode of action of IUDs excludes. Mode of the action of IUDs does not include what? Suppressing the fertilization capacity of the sperms, preventing the insemination, increasing the phagocytosis of sperms within the uterus, or making cervix inhospitable to the sperms. Absolutely correct. IUDs, right, have no relation in preventing the insemination. Absolutely correct. Rest, of course, are the functions of the IUDs. Okay, last question, everyone, of our class today. Here we have, if the length or the reproductive cycle of a human female is 32 days, then what will be the time period of the periodic, abstinence, or a natural method of birth control? This is an interesting question. I'm sure you'll be able to use the logic over here. Little phase, remember, everyone. It is same, right? Let's see if you'll be able to find out the answer for this question. 28 days mein hota hai at the 14th, right? So 32 mein se you can easily minus. I can see a mixed bag of the answer. A and C ke paas mein vote ja rahe hain. But what will be the correct answer? Very good. Now all of you are giving the correct answer. The correct answer is option number C. 14 to the 21st day, right? Clear, everyone? Awesome. Basically, these are duration of the ovulation. Yes, option number C is the correct answer. Very good. So with this, everyone, we are done with our class today. And like within 1 hour and, within 1 hour and less time we are, we have finished a chapter. I think 1 hour and 20 minutes approximately. नीट एस्पिरेंट बिल्कुल बच्चे 70 में 70 आ सकते हैं, पूरे साल अच्छे से डिसिप्लिन से पढ़ाई करिए, बिल्कुल बहुत अच्छा है. नीट एस्पिरेंट अभी आप परेशान मत हो, यू हैव द टाइम फॉर योर एग्जामिनेशन, यू विल बी स्कोरिंग गुड, राइट? चलिए, वेरी गुड एवरीवन, थैंक यू सो मच एवरीवन. सो इन द नीट पर विजय का सीरीज हम इसी तरीके से आगे पढ़ाई करेंगे. फर्स्ट सेशन थोड़ा सा लेंदी हो गया था, बट वी विल बी मेकिंग श्योर दैट यू आर फिनिशिंग one chapter right in a day, and of course we are solving the questions also, so that it can boost your confidence. Chaliye, everyone, please make sure if you haven't subscribed to the channel, subscribe to the channel and hit the like button for the video, and अपनी ये वीडियो को अपने फ्रेंड्स के साथ में शेयर करना ताकि they can also learn along with you guys. We'll be meeting really very soon everyone. Do take care of yourself and keep on learning with Aakash BYJU'S. Bye bye.